A very bright and talented little girl, words from Stella-Lily's school, the latest victim to a viral infection impacting the nation. In Belfast, the 5-year-old was struck down with Strep A. It's left her school in disbelief and her family suffering unbearable pain. But children with colds, flu and this infection isn't uncommon at this time of year. The increased levels of sickness, though, is, and it's causing concern. Particularly at Alder Hospital. Its emergency department is the busiest it's ever been.
Having our busiest winter ever, I think our colleagues around the country are seeing that from all the doctors and nurses everywhere. So we were already really busy, and I think since over the last couple of weeks, I think since we've been hearing a lot more about Group A strep, there's been a lot more concern about children who might have it.
Across the UK, the number of children with invasive Group A strep is 4 times higher than normal. What is usually a mild infection is now, in many cases, causing serious harm. So today, the government suggested medicinal support for schools with outbreaks as an option.
What the UK Health and Security Agency are doing is they're working closely with the schools involved and giving very specific advice to those schools, which may involve use of penicillin and so on.
All we've got left is probably about 4 tubs of the penicillin.
But a mass rollout of penicillin is something one pharmacy director says would be near impossible.
There's no drugs. Today we haven't been able to get any penicillin in stock at all, and we have at least 7 different suppliers that we can turn to, and none of them stock it. So then when we hear stories about possibly giving antibiotics to all children in schools, it just shows how out of touch the Department of Health is.
But it's not just an issue for Zishan. The National Pharmacy Association today revealed lines of antibiotics used to treat Strep A infected children are temporarily unavailable. There is real concern over the spread of the infection across the northwest. Here, cases of scarlet fever caused by the bacteria which leads to Strep A are the highest in the country. And the front line for this infection is the classroom. This primary school in Cheshire today received updated guidance from government, but because of a rise of sickness since October, they've already taken precautions.
So today that's 90% for us, which is significantly lower than it has been at all this year. So that's around 40 children for us off with those kind of symptoms that are missing out on their lessons.
COVID-19 dominated our lives for almost 3 years, and it's easy to forget the other infectious diseases that are still causing problems. But despite scientists' prior knowledge, Strep A remains a worry for parents across the UK, and having the resource to manage it is now a great concern. Inzaman Rashid, Sky News, Manchester.